Hi friends, in this session we'll be covering the MCQs that have come from Forensic Medicine and Toxicology in 2025. Okay, all of you can see. Let me just see. Yeah, all right. So read the question. All the questions that came last year, all of them are very simple, very scoring subject on a FMT. Let's start. During autopsy, a body shows curved scratch marks below the right angle of the mandible, three grouped bruises on the left side of the neck, below the thyroid cartilage, additional marks over the head, posterior shoulder, backside of the trunk, hip crest. Fracture of the superior horn of the thyroid cartilage is also present. What is a most likely cause of death? So, whenever, especially this point, when you see the cartilage, thyroid cartilage fracture, you can see there were marks where the patient, not the patient, or where the person tried to resist the attack. You can see there are scratch marks, bruises over the neck area. All of these points tell you that this is a kind of throttling. What is it? Throttling. Now, first we'll discuss what is throttling, garroting, mugging. We'll come back to the question. Okay. Yes. Yeah. What is throttling? Throttling means it is manual strangulation. You can see the pictures here. Okay. A strangulation artham endana. Strangulation means when pressure is applied over the neck. Okay. By any means, കൈ കൊണ്ടാവാം, റോപ്പ് കൊണ്ടാവാം, അല്ലെങ്കിൽ കൈൻ്റെ എൽബോസ് കൊണ്ടാവാം, ഹാൻഡ്സ് കൊണ്ടാവാം. By any means, if pressure is applied on the neck, what happens? എന്ത് പറ്റും? Blood supply to the brain decreases, and if it goes too severe, it can lead to death. അപ്പോൾ blood supply to the brain decreases, this causes asphyxia. Okay, if that is not treated or stopped, it leads to death. So throttling, that is manual strangulation. You can see the picture, image based questions. Okay, now that is what, see, pressure on the neck using hands or fingers. This causes what? Asphyxia. Can you guys tell me what is asphyxia? Asphyxia definition and it is the lack of oxygen to the body, especially the brain, because of interference with breathing or blood flow. That is a definition of asphyxia. So I hope you understood what is throttling. This means of harming a person. Here you can see the scratch marks because kai aanallo ubhayikkunnathu, right? Appo ee ingane cheyyunna aalude kayile finger shaped marks കാണാൻ പറ്റും, scratch marks കാണാൻ പറ്റും. And since the neck is being targeted, you can see there is fracture of the hyoid or thyroid cartilage. 1 second guys. Yeah. So this point is important. Fracture of the hyoid or thyroid cartilage may be present, and of course signs of struggle and down, right? So all these points were there in the question. There were signs of struggle, there were marks on the neck, also there was fracture of the thyroid cartilage. All of these point towards throttling. Okay, throttle in artham endanariyo? Throttle, not throttling, throttle. Throttle means to choke a person by any means. Okay, to choke a person, that is called as throttle. Fine. Moving on to the next kind of killing a person, that is called as garroting. Okay, garroting. And the garroting, it is a strangulation using a rope or a wire tightened from behind. See, garroting means, as you can see in this picture, okay, this person is a target. Let me take a different color. I'll take black so that you can see properly. Yeah, yes. So you can see this person, Yeah, from behind, അയാളുടെ ബാക്കിൽ നിന്ന് another person has tied a rope around his neck, okay, and then he is tightening it. So this is called as garroting, basically strangulation. Where the person who's harming, he takes a rope or a cord, a wire, and ഒരാളുടെ ബാക്കിൽ നിന്നായിരിക്കും അറ്റാക്ക്. ഓക്കെ, കഴുത്തിലേക്ക് ആ വയർ ഇട്ടിട്ട് ബാക്കിൽ നിന്നായിരിക്കും അത് ടൈറ്റൻ ചെയ്യുന്നത്. സോ ദിസ് കൈൻഡ് ഓഫ് അറ്റാക്ക് ഇസ് കോൾഡ് ആസ് garroting. You can see a rope wire that is suddenly pulled tight around the neck, usually from the back, and this causes asphyxia. So because of this kind of torture, okay, there is a horizontal mark on the neck. ഇയാൾ മരിച്ചു കഴിഞ്ഞ് നിങ്ങൾ എക്സാമിൻ ചെയ്യുമ്പോൾ what can you see? Where is my cursor? അവിടെ പോയി cursor. You can see what? Horizontal ligature on the neck. A ligature mark on the neck. And since a rope is used, ഒരു കട്ടിയുള്ള വയറായിരിക്കുമല്ലോ ഉപയോഗിക്കുന്നത് അയാളെ കൊല്ലാനായിട്ട്, സോ ആ മാർക്ക് will be often deep. ആൻഡ് ഇവിടെ ഫിംഗേഴ്സ് യൂസ് ചെയ്യുന്നുണ്ടോ, ഹാൻഡ്സ് യൂസ് ചെയ്യുന്നുണ്ടോ? ഇല്ല. സോ യൂഷ്വലി ദർ ആർ നോ ഫിംഗർ നെയിൽ സ്ക്രാച്ചസ്. ഓക്കെ, ആൻഡ് സംടൈംസ് ഫ്രാക്ചർ ഓഫ് ദ നെക്ക് സ്ട്രക്ചേഴ്സ് ക്യാൻ ഓൾസോ ബി വിസിബിൾ. ഓക്കെ, സോ ബേസിക്കലി റിമെമ്പർ, ബാക്കിൽ നിന്നാണ് അറ്റാക്ക് വരുന്നതെങ്കിൽ യൂസിങ് എ റോപ്പ്, ദിസ് കൈൻഡ് ഓഫ് അറ്റാക്ക് ഇസ് കോൾഡ് ആസ് garroting. Okay, image based question ആയിട്ട് വരാം, important. Moving on. Okay, this is what you can see. Okay, this is mugging. Okay, this kind of attack is called as mugging. Here, in mugging എന്ന് പറഞ്ഞാൽ, see, you know what you mean by mug. Long back. One second, guys. Long back. Mug എന്ന് പറഞ്ഞാൽ slang was used to say face. Okay, മകെന്നവർ ഉദ്ദേശിച്ചത് ഫേസിനെയാണ്. ഓക്കെ, സോ പണ്ട് കാലങ്ങളിൽ ഇപ്പോൾ റോബറി ഒക്കെ നടത്തുന്ന സമയത്ത് ലോങ് ബാക്ക് വാട്ട് ദേ യൂസ് ടു ഡു, ഫേസിലായിരിക്കും ആദ്യം അറ്റാക്ക് ചെയ്യുന്നത്. ഒന്നെങ്കിൽ ഫേസ് പഞ്ച് കൊടുക്കും, അല്ലെങ്കിൽ ഫേസിലായിരിക്കും അറ്റാക്ക് ആദ്യം ചെല്ലുന്നത്. ഓക്കെ, അപ്പോൾ ആൻഡ് ദേ യൂസ് ടു rob something and go. Okay, so this kind of attack, it is called as mugging. A robbery carried out by attacking or threatening a person in public to steal money. Okay, and so this is called as mugging. Here you can see, okay, facial maatra airikil attack, the person, okay, the culprit, he shoots the person by his elbow വെച്ചിട്ട് കണ്ടോ, ഈ പിക്ചറിൽ നല്ല ക്ലിയർ ആയിട്ട് നിങ്ങൾക്ക് കാണാം. See, the attacker, okay, അയാളുടെ എൽബോ അവരുടെ നെക്കിൽ ടൈറ്റൻ ചെയ്തേക്കാണ് അല്ലേ. that causes what? Asphyxia. Okay, basically to choke her. So this is called as mugging. Now the next kind, it is ligature strangulation. Ligature strangulation means what? It is a strangulation using a cord, a cloth, a rope tightened around the neck. So ligature strangulation, see guys, നമ്മൾ garroting പഠിച്ചില്ലേ? garrotingൽ ഞാൻ എന്താ പറഞ്ഞത്, ഒരാളെ ഒരു റോപ്പ് വെച്ചിട്ട് അല്ലെങ്കിൽ കോഡ് അല്ലെങ്കിൽ ഒരു വയറ് പോലൊരു സാധനം വെച്ച് ബാക്കിൽ നിന്ന് നെക്കിലേക്ക് ഇട്ടിട്ട് അത് ടൈറ്റൻ ചെയ്യുന്നു, അതാണ് garroting. ഓക്കെ, ആ സെയിം തിങ് തന്നെ, ഓക്കെ, ദാറ്റ് ഇസ് ligature strangulation, except that ഇവിടെ ബാക്കിൽ നിന്ന് ആവണം എന്നില്ല അറ്റാക്ക്. Ligature strangulation, basically they using a ligature, meaning a cloth or a cord, okay, and വിക്ടിമിൻ്റെ കഴുത്തിലേക്ക് അവരത് പ്ലേസ് ചെയ്തിട്ട് ടൈറ്റൻ ചെയ്യുന്നു. അത് ചിലപ്പോൾ ഫ്രണ്ടിൽ നിന്നാവാം, സൈഡിൽ നിന്നാവാം, ബാക്കിൽ നിന്നാവാം. ഓക്കെ, സോ റിമെമ്പർ ദ സ്റ്റേറ്റ്മെൻറ്റ്. garroting, it is a kind of ligature strangulation. ligature strangulationൻ്റെ ഒരു ടൈപ്പാണ് garroting. ഓക്കെ, my question is ligature strangulation equal to garroting? നമുക്കങ്ങനെ എപ്പോഴും ഉറപ്പിച്ച് പറയാൻ പറ്റില്ല. ligature strangulation മീൻസ് ആ ഒരു റോപ്പ് ശരിയാണ്, റോപ്പോ കോഡോ എന്ത് വേണമെങ്കിലും ഉപയോഗിക്കാം, രണ്ടിലും, garrotingലും ligature strangulationലും. പക്ഷേ ഇവിടെ ഈ ligature strangulationൽ അറ്റാക്ക് ഏത് സൈഡിൽ നിന്ന് വേണമെങ്കിലും ആവാം. ബാക്കിൽ നിന്നാണ് അറ്റാക്കെങ്കിൽ garroting. ഓക്കെ, ഫൈൻ. സോ ലെറ്റ്സ് ഗോ ബാക്ക് ടു ദ ക്വസ്റ്റ്യൻ. ഓക്കെ, നൗ ഐ തിങ്ക് ഇറ്റ് ഇസ് ക്ലിയർ. ഇത്രയും ഡീറ്റെയിൽസ് അവർ തന്നിട്ടുണ്ട്, റൈറ്റ്? ആൻഡ് ബൈ നൗ യു വുഡ് ഹാവ് നോൺ ദാറ്റ് ദി ആൻസർ ഇസ് throttling. Okay. Moving on to the next question. What is a Zarco phenomenon? See, Zarco phenomenon. Am I audible, guys? I'm a little low on energy. I hope I'm audible. Huh? Okay. Zarco phenomenon artham endana? We'll just discuss the answer. Very simple. It is a tendon reflex occurring after death. Death initiation, right? The tendon reflex occurring after death. That is called as Zarco phenomenon. Now, guys, tell me, after a person is dead, will you expect him or her to show a tendon reflex? For example, let's say patellar reflex. Okay. Quadriceps tendon, you go and hit, not hit. You try to elicit the patellar reflex. Would you expect to see it after death of a person? The answer is yes, you can see that reflex, any reflex, up to 2 hours after death. Up to 2 hours, tendon reflexes okay. Why so? Because after death initiation 2 hours, muscles, they have the residual ATP, right? Energy and calcium ions. So mechanically, muscles and tendons irritate. That is, if you're checking the tendon reflex using the hammer, then these muscles will react because our ATP our calcium ions adellam deplete after death. So the muscles, they are going to react to your test of tendon reflex. So what you do is, after death of a person, if you want to see that, okay, go and find you can see the patellar reflex. Patella 10 centimeter above the patella. You use the hammer, just hit there slightly. The quadriceps will contract, it will move the patella upwards. Okay, you can elicit, you can see that even after death. So this phenomenon is the Zarco phenomenon. Alright? Simple? Okay. Next. The protection of children from sexual offences. What is it called as? PYQS. Now this was another question. What is the full form of PYQS? Can you repeat after me? The protection of children from sexual offences. This act covers which of the following groups? See, how easy can they make? Idinekal easy right? So whoever made the question paper of forensic last year, they deserve thanks. Because I heard that FMG, FMG, the pass percentage was very, very less. I think 23 or 26% of alkar matrame pass aayitullu. I read it somewhere. Which is, see, FMG is in the licensing exam, right? They shouldn't have made it so tough. 23 or 26% of pass means there is something. Okay, they should slightly make it easy, right? If I was the examiner, I would have made sure that at least, let's say, 85-90% students would have passed. See, it is a licensing exam. We're not, I don't know why examiners make it tough. Okay, so, PYQS Acts covers which of the following groups? Tell me. It covers all children below the age of 18 years. Okay, answer B. Right? Now read, very simple. The question looks big, but use your logic and answer. A 68-year-old female presents with breathlessness, declining health, and is found to have multiple meds. She is awake, she is alert, and she is awake, she is alert, she is visibly anxious. The medical team assesses that aggressive chemotherapy, radiotherapy, ICU care, mechanical ventilation would not improve her condition and may cause harm. Despite this, the patient's daughter insists on pursuing all possible life-prolonging measures, including ICU admission. What is the most appropriate next step for the physician in managing this case? You understood this question, right? The doctor himself says that aggressive management would not be doing any good to the patient. But the patient's bystander insists that we continue the patient at the hospital. So what is your next step? Convince family meeting considering patient values and goals of care. Admit to ICU and initiate aggressive treatment. Discharge and shift to home palliative care. Start placebo treatment. I'm sure you guys would have guessed it right. You convince family and tell them about the patient values and goals of care. Okay, so this is what you should do. But this question is very I don't know if we get to see it very frequently in our practice, because whatever I have seen from my practice, not my practice, I have worked as resident under few senior doctors, and few of them. അവരിങ്ങനെ പറഞ്ഞത് എൻ്റെ അറിവിലില്ല, which actually this is good. See, നമുക്കിപ്പം if the patient requires palliative care, just send them to that, right? അല്ലാതെ ഹോസ്പിറ്റലിൽ പിടിച്ച് കിടത്തി it's very wrong to load them, and that's what we see in hospitals these days, right? Okay, so that is it. We have covered all the questions, FMD questions. Last year വന്ന എല്ലാ questions നമ്മൾ cover ചെയ്തിട്ടുണ്ട്. Very simple, forensic medicine, very scoring. I'll see you all in the next class. Take care, eat healthy, and